Wilbert Keon was born in Sheenborough, Quebec, the youngest of 13 children. He knew in his teenage years that he was going to be a doctor, and from then on was seemingly able to envision a clear path for his future.
He was very convinced of what he wanted, even back in his training days. So he never had any doubt in his mind that when given the resources and the appropriate time, he knew exactly what he wanted and he was going to do it.
And that early vision during his residency included building an innovative cardiac facility, which would become the world-renowned University of Ottawa Heart Institute.
I wanted to be able to have access to a major general hospital, but I wanted enough autonomy to put everybody around the table thinking heart.
It had the coronary care unit, it had the surgical recovery, cardiac surgical recovery unit, it had the cath labs, all in one area.
This place became famous all over the world because we were operating on acute heart attacks when virtually nobody else was, and indeed we built the place so we could do it successfully.
We could do emergency angiograms and ship the patient across the hall to the OR.
He had the early concept of operating within a few hours of having a heart attack. And so we did one of the first studies in the world.
And we started, reperfusing the acute heart attacks with surgery, with coronary bypass.
The original concept of opening up the artery or providing blood flow to a blocked vessel right away in a heart attack to save muscle was something that he really had developed very early on.
We did the first Jarvik 770 in Canada, and indeed the first 770 in the world. I was able to convince the ethical authorities in Canada to allow us to use the artificial heart as a bridge and then transplant the patient.
We moved her directly to the operating room because she was dying, and he bypassed her. She still was not doing well, so he put the Jarvik in her. And in a week she got a new heart. She lived until very, very recently.
I did the first infant transplant in Canada also.
The only way this baby was going to live was to have a new heart. And there was no one else in Canada doing it at the time. And there hadn't been very many done in the world.
At 11 days old, Wesley Beam received his new heart in a pioneering procedure by Dr. Keon and his team. Now at 18 years old, Wesley works with his father's logging business and often enjoys pulling out the tape of the surgery to watch the miracle that gave him a life that was hardly possible before the existence of the Ottawa Heart Institute.
I'm watching Dr. Keon and his team take my old heart out and replace it with a new one.
Leafing through the photo album allows Wesley's parents to remember some of those special moments.
When he came up after he had done Wesley, oh, he says, I can tell you now he's going to live a long, lengthy life. I said, how do you know that? He said, everything went so well.
Dr. Keon has created a rich legacy as a builder of medicine in Canada. His impact on Canadians continued as he moved from the operating theatre to the political stage.
Things in this country would be hugely different in healthcare if Willie Keon hadn't weighed in the way he has.
But I didn't plan on being in the Senate, let me tell you. It came as a complete surprise.
And the work he's now doing on population health is something that he passionately believes in. And you can bet that when that report comes out, it will be a world-class report. And it will have a long-lasting impact the way his other public policy work has done.
Canadian Medical Hall of Fame Laureate for 2007, Dr. Wilbert Keon.